Okay, Bismillahirrahmanirrahim. Let's start with the section D section, the sociology and anthropology during the health and the disease condition, or the third pillar of behavioral sciences, the social aspect, the health and disease. Before starting, I just want to clear one thing regarding the performance, regarding the feedback, as the output was very poor. Only 15 students among the 40 participated so far. I want to clear one thing very clearly, that we are not interested in any kind of personal information of the class, like the passwords, like the login information, like the contact numbers. The purpose of designing this feedback was that so that we have the insight regarding the actual issues which you guys are facing in learning the behavioral sciences as subject. Although it was a common misconception that this subject is useless and blah blah etc. Whatever you consider it, but you have to pass it in order to clear your second professional exam as per the university guidelines. So, as the response was very poor, so we even cannot, interpret these few performers regarding the actual issues. So I will request all of you that go today and please fill it, because if we don't have the majority performers, at least 35 or 36 out of 40, then how we can conclude a guideline regarding the future exams pattern, regarding the future teaching pattern, regarding the revision pattern. I can understood that the supply is going on, but that doesn't mean that you cannot find the 5 minutes, right? I think there are only hardly 10 to 20 questions, and it only takes 3 minutes, or might be 5 minutes at maximum. And, also, I will appreciate the efforts of BR that is coordinating with me, but seriously, we are disappointing from all of you. So, as we don't have any feedback from you guys, we are just like wandering in the without light, and we have no idea that how you can better understand this subject, how you can better attempt the questions during this exam, during the test, and etc., each and everything. Well, those who fill those feedback performers, we definitely will consider it. But my point is that by only considering the 15 performers or the 15 people, opinion among the whole class, it doesn't represent the majority group. Like for example, I guess only those guys fill the performers who already passed the test. So basically, the purpose was to gain the insight, especially for those students who become fail in clearing the test, so that we have the idea that where the problem lies, whether it's a test structure, whether it's the problem in the attempt, whether it's a problem in the lectures, where the problem lies. uh, yes, but the majority didn't fill it. No? That was the problem. That's my main concern, actually. So I will request again that please fill it up as soon as. So before as you know that the next test is on 13th June, probably in the next week, right? So before designing that test, I will request please fill it so that we can structure the questions in a new way, which should be intelligible, which should be understandable by you guys. So that was a main purpose. So go and fill it today. Thank you. So let's start with our lecture. Okay, so we are going to start a new section, a new pillar of the behavioral sciences, the sociology and the anthropology among the health and disease. Although it seems that there is no need to study the social structures, there is no need to study the you know how our ancestors was, there is no need to study the culture and each and everything. But let me tell you one thing. Behavioral sciences, in simple words, is all about the behavior during the health and the disease condition of both the healthcare providers as well as the patients. From where this behavior is derived? Obviously, we're born without any behavior, or we're born with just one behavior known as the crying. Is it? So from where we adapted this, the multi-value, the multi-aspect behavior, we drive it from only two ways. Behavior is nothing; it's just a reflection. It's just a feedback. Feedback to whom? Feedback of our own actions. Like I did this thing and this happened to me. So next time, if this happened to me in a positive way, I will definitely adapt it. And if this happened in a negative way with the negative consequences, then I will make sure to avoid it. And secondly, this feedback is derived from our people who are surrounding us, or in scientific words known as from our society. So those aspects of behavior which are the result of the reflection of our own feedback, we studied in the section C, the psychological principles, the learning, the memory, the intelligence, blah blah, and etc. Now, the second most important aspect of the behavior, like what the other people think about us, what the other people, how the other people influence us, how the other people's practices, how the other people's beliefs, how the other people's ideology can influence our health and the disease practices. All of these things comes under the heading of sociology and anthropology. Don't confuse with these difficult words. Sociology is simply the ideology, the reflection, the feedback, the practices of the living people around us, today's people. And anthropology is the same thing. We can decode anthropology as the sociology of past, or sociology of our ancestors, the sociology of the dead people, or the sociology of the people who left this world while they didn't left the ideology. Got my point? So in this section, what we are going to study, we are going to study uh, the the ideology, the core ideas, the thinking of the people around us, and we will relate it, that how this core ideology become influence, how this core ideology influenced our health and the disease system, how this sociology thing and this anthropology thing changes our beliefs, changes our vision regarding the health and the disease. As far as the dentistry is concerned, studying the sociology and anthropology is even of greater importance while studying the psychology. Reason being, there are a lot of diverse ideology regarding the dentistry among the whole world. Maybe in some very well mannered, well educated society, people don't consider it as a necessary treatment option. So studying this aspect is as important as studying the section C, the B, and the A. So let's begin with it. But before starting this section, let me clear you one thing. Sociology and anthropology is itself a whole science, is itself a whole dimension of social sciences. So we will limit this dimension only to the limit of our profession. Our professional limit is not beyond the health and the disease. That's it. So we will only study the social and the cultural or the anthropological aspects of those factors in the society which brings about the health, which promotes health, and which can undermine the disease. Got my point? So hopefully the purpose of teaching this section is clear. If not clear, then please ask in the comments so that I can continue with the actual content. Is it clear? Or there is any confusion that why we are reading this whole this thing? Quickly share it in the chat option. Is everyone there? Or I'm just talking to a laptop? Okay, good enough. Okay, so let's begin with it. Okay, Ji. So the agenda of today's lecture is what is the medical sociology and how it's related with our medical or the dental profession. What is the culture and how we can utilize this, sociology and the anthropological knowledge in your future practice or in your future medical life or the dental life. Now, let's review the basic thing which I just told you a few moments back, that the biopsychosocial model or the basis of the behavioral sciences is based on the three principles of the science or the social science. One is known as the biology, one is known as the psychology, and third is known as the sociology. Obviously, biology are you teaching in the form of the pharmacology, pathology, anatomy, etc. Psychology you just have learned in the section C, and now come to the next thing, the sociology. Now, let's define first it. Sociology, as the name depicts, you can divide this word into two parts: social and logy. Means a scientific study of the society and the social behavior. That's it. When we use the word the scientific study or the scientific methodology, then this means that now the study or now the thing based upon certain principles. We conclude principles, we formulate the laws, and then we test these laws, these principles under the diverse conditions. And these laws, these principles, they must yield the similar results. This is known as the scientific knowledge. So the study of society, the study of the social behaviors based upon the certain scientific principles, based upon the certain scientific laws, is known as the sociology. Whereas anthropology, as I depicted earlier, as I told you guys earlier, it's a sociology of our forefathers, the sociology of those people who left this world. So anthropology is the study of the various human values, various human behaviors who were present in the past, who are not living nowadays, but their values, their thinking, their ideology, it's still there. Got it? So anthropology is basically the study of the past and the present societies. Present society, we use this word as we are relating the present social values, we are relating the present social behaviors with the past ideology, that from where this present values they emerged, from where this ideology, from where these ideas, from where this thinking has come into being. So that's the study of the anthropology or the study of our culture or the study of our forefathers, sociology, etc. You can use any word. Hopefully it's clear. As you can see that. So what do you think that if I give you two options that you have to fit in the two words, one is the sociology and one is the anthropology, on these two pictures. So the picture on the right side, the man with the computer and the chimpanzee on the back, you will label it with sociology or the anthropology. Quickly comment it in the chat section. Quickly, anthropology. Good, good enough. So that you got the idea that the picture on the left side, it's basically depicting the sociology, whereas the picture on the right side, the man with the computer, that how we reached from this chimpanzee thing to this modern smart humans. This study is known as the anthropology. So let's continue it. So today we will start with the sociology part. Obviously, if we knew the normal biology, then we can only study the pathology. So let's begin with the normal social structure, or let's begin with the normal how the society works, what are the subcomponents of the society, how we divided the the social strata, how we divided the people in the society, etc. So let's begin with the sociology. Among the sociology, the main thing or the main component is the culture. Culture is nothing Culture in simple words, invisible. Culture is something which you cannot translate, but culture is obvious. Culture is very, shining via the behaviors of the people who are living in that particular society, who are living in a particular culture, who are adapting that culture, who are adapting the values of the society, etc. You can depict it in the form of the behaviors. Otherwise culture is written nowhere. But culture is something which we show in our behavior, like the things, right? From sleeping towards the early morning, we wake up, all those things, all our practices, all our choices, these are derived from our culture. So culture is the outcome of man-made part of our environment. Obviously nature didn't give us any culture. It's something which humans derived. Culture consists of abstract values, beliefs, and the perception. There are two things in the scientific knowledge. One is known as the abstract, and other is known as the crystalline. Abstract means the things which can be modifiable, the thing which can be upgradable or the downgradable. So culture is the mixture of the values. We will define these words: the values, the beliefs, and the perception of the people who are living in that culture. Culture is obviously something which is dynamic, which is continuously evolving. It's not static. Um, uh, as if you guys demand, the culture of the early 2000s of Pakistan is entirely different from the 2020, isn't it? Or the culture of the whole world in the early 90s, it is entirely different than the culture of today's. If anyone from the early 90s who died in the early 90s came into today in the 2020, he would be surprised by the gadgets, isn't it? He would be surprised by the way people do the shopping, people eating, etc., and etc. So culture is something which is continuously evolving, which is adapting the the changing mother nature. So obviously there are subcultures which exist within the culture. As we, if we said broadly, what is the culture of the Pakistan, how you will label it? Quickly write it in the chat. Let's say someone asks you from abroad that how you will define or how you will label the culture of the Pakistan, how you will label it, which words you want to attach with it. You guys are on break, or I guess simple. What else? This based on Islam, yes, good enough. Yes, we can label it as Islamic. As the simple people, it's not a scientific term. You cannot define the complex people and the simple people. But yes, you can define it as the people are more straightforward. People are more, have a particular way of living, etc. We can define the Pakistan culture as the Islamic culture, mostly derived from the Islamic values. But let's say if someone said that, define the culture of Punjab and the Sindh. Obviously, these two cultures are a little bit different. There exist, and within the culture of Punjab, there exist lot of varieties, like the culture of the South Punjab, like the culture of the North Punjab, etc., and etc. So the point of talking all this is that there exist the subcultures within the main culture or within the main culture stream. So uh, let me revise this slide. Culture is nothing. Culture is the ideology how the people live their lives. So culture is simply defined as the man-made part of our environment. Components of culture includes the values and the beliefs and the perceptions. Got it? Culture is not static. Culture is not in the hard written form. It can be, but not always. But culture is something which is evident from the behavior, from the lifestyle of people, and there exists the subculture within the main culture. So basically the culture is something which is a mixture of all these things which you are now seeing right now in front of you. Attitudes drives our beliefs, Our beliefs drives our customs. Customs, you know what is what are the customs? रवायात, right? बड़ों को सलाम करना है, वो जो है झूठ नहीं बोलना, etc. Customs then drive our values. Values will again determine our attitude, and this circle begins till the end of our life, right? Now the today custom is that we should not shake hand with other people because of this COVID-19 thing. So this custom change our values of the shaking hands, and this value is directly changing our attitude. Now we are seeing someone, we just instead of shaking hands we are just saying the salam by the gesture. So this attitude is changing our belief that under this contaminated thing, under this thing, we can modify our lifestyle, we can modify our other things of living. So in this way, this loophole continues till the end of our life. Now, the elements of the culture. The most interesting thing regarding the culture is that most of the parts of the culture they are hidden. You cannot directly observe them. You can only directly observe all these things which are the tip of the iceberg, like the dress code, like the food taste, like the language, like the games, arts, etc., etc., and so on and so on. So, what is the importance of all this knowledge regarding the culture while practicing a dentistry? As we said that culture is something which is not evident. So in future might be patient is doing a practice which is not written anywhere in the scientific literature, which may be against the scientific literature, but they are doing it based upon the this cultural practice. For example, the concept of not using the toothbrush, the concept of using the miswak, right? The culture of the myths about the extraction of the tooth, the myths about the scaling of the tooth, the myths about the root canals, each and everything. So where all this ideology, where all these thoughts are coming from? Obviously they are coming from the people who are surrounding our patients, who are surrounding our the population, the disease population. So all these beliefs, all these values, they are directly hampering our, the disease practices, our the health practices. Yes, it is another example. Got it? So hopefully now you got the insight that what culture is, what are its subcomponents, and how we can determine it, how we can check the culture of a particular area. So for a holistic physician, for a holistic dentist, it's very important to know the culture of his treating population. Without knowing the culture, you cannot get the insight about the core reasons of the behavior of of your patients. How the culture influence our the healthcare practices. And the most up till now everything is clear or not? Please quickly write it down. Okay, good. Okay, so the most interesting thing regarding the culture is that it directly shapes our beliefs. Our action is nothing. First you have to understand a loop. Our action is the result of something which is going on in our head, which is going on in our minds, which is going on in our unconscious, if you talk in the scientific terms. First the thought come due to some external or the internal stimulus, then this thought yields towards the analytical portion, towards our intelligence portion, which you have studied all these things in the section C, that how the mind works. Then this thought influences our perception. This thought influences the way we are interpreting our environment. Then this thought become our action. Is it? You believe on this loop which I just told you? So the most interesting and the most maybe good, maybe bad thing about the culture is that it directly shapes your beliefs. It directly shapes your core ideology regarding the solution of different things, regarding the lifestyle, each and every aspect of a person. Next point is that these beliefs are largely diverse and vary with the social class, with the educational background, with the urban and the rural setting, with the influence of subculture, etc. The point which I written in the numeric value 1, 2, 3, 4, these are those variables which can influence our belief. Why these variables are influencing our beliefs? Because these are the examples of the subcultures. These are the examples of the different cultures within a similar society. So basically, what's the influence of culture on the healthcare? If you told in a nutshell, that it directly changes it directly shapes the beliefs of a person, right? Okay. Now, as the culture shapes the belief of a person, it will directly shapes, it will directly influence the view of a person regarding the health and the disease. If this view is in the positive way, then it will generate the positive beliefs. If this view regarding the health and disease in the negative way, then it will change the it will generate some negative feelings, negative attitudes regarding the health and disease. For example, you guys have just seen in the past days regarding this COVID-19 thing, that people are bringing their patient. There is no corona like thing. It's very common circulating on the social media, that there is no corona like thing. People are just taking their patients to the hospital, and for the sake of money making, the doctors are injecting something, some poison into the bodies of the patients, and as the doctor have to will get the share of the dead bodies from the WHO, and so the patient dies immediately within the 2 days, within the 3 days, and blah blah, etc., etc. And you see that in the news, on the social media, that the numerous violence activities, numerous violence incidents happened in the past week, right? So why this whole activity happened? Because the culture of our this Punjab, this Sindh, this Balochistan, it directly shapes the beliefs of our people. People of the Pakistan, unfortunately, they do more believe on the on this negative propaganda than on anything else. So this belief directly changes the view of the people regarding this COVID-19 thing. So as per this view change, as per this belief change, so the practices of people are right in front of you. Hopefully you got my point, that how the culture shapes our thinking process. Now, so in the same way, obviously, when the view will change, when the belief will change, so it will change our perception, it will change our way where we should look for the help, and who we should approach, first approach, regarding the health and the disease, and how the patients interact with the the healthcare provider, and what is the understanding, what would be the compliance rate, etc., and etc. So these things are all the outcome of the beliefs, which directly shaped by our culture, will directly shaped by the people around us. Got it? Okay, so what we can do, we can bring the positive interaction, we can bring okay, fine. There is a one way. Always remember one thing: you cannot change the beliefs of the people. You cannot afford, while conflicting with the values, while conflicting with the core ideology of the of a particular culture. So never mess with it. So what we can do, we can just bring the positive change via giving the informational care in a scientific manner, via improving our communication skills, via improving our the breaking the bad news protocol, etc. All those things which we have studied in the section A and the section B. So in nutshell, while sticking with the medical ethics, while sticking with the ethics of our profession, we can bring about the positive change. We should not expect that a doctor who is debriefing his patient, he will change all the beliefs or the values which the patient, cultivate with the patient, brought in his whole life in the 40 years time period or in the 50 years time period. It's very impossible to change the beliefs, or change the values, or to change the the ideology of the patients. So there's no need to change the ideology, but there is a need to improve our communication skills. There is a need to practice the informational care. There is a need to practice the all those aspects which we have just studied in the previous sections. Got my point or not? Got it? Okay. Never say like this that your opinion is incorrect. You are talking about the rubbish, etc. and etc. Okay, now, if someone tries to change that core belief, core ideology of a people, of the persons of the culture, then there is likely a conflict would result. We can see the negative self-image of the doctor, which have changed in the previous 10 years. No doubt in it that the people are illiterate. No doubt in it the people need to modify their thinking. But there is an equal need that the doctors should also change their way of behaving towards their patients, right? A doctor have no right to doing the insult or undermining the self image of any patients. If you just dig deep why all these conflicts happen, if you just dig deep about any incident which happened in the past 5 years, that why the a mob or the some 10, 20, or 30 people came and they beat up the doctor, then there's some serious mistakes which the doctor community are doing on the daily basis, that might be challenging the local beliefs of the people, that might be challenging the the core ideology of the people, that might include violating our own medical ethics, that might include violating our own core communication protocols. For example, we don't bother while extracting the tooth, the core reason behind the extraction or the core reason behind doing any procedure. There is a common practice that we are just taking the consent in on the paper without telling them the consequences, without telling them the risks of the anesthesia, etc. And when that patient become expired, because first you put him or her on such a high pedestal, you put him or her in such a high hope that after this surgery, after this procedure, the patient will absolutely become the fine. But when that particular patient become expired, what you expect from his family? Will they will respect you, or will they beat you? Obviously they will beat you. So to avoid such cultural conflicts, that one should stuck to his own customs, one should doctor, I'm talking about the doctor should stuck to his own beliefs. He should not try to the force his own beliefs, his own values on the patients, right? But he can communicate the message in the positive way via via practicing the unconditioned positive regard, via practicing the all those communication principles which we have studied in the previous sections. I guess there is no need to repeat it. And yes, one should accept and acknowledge his mistakes. If something happened like this, just say sorry. There is nothing hampered in it. Okay. So far, culture is clear. So far, importance of culture is clear. So far, our role is clear while practicing in the diverse cultures. So let's come to the fabric of the culture, or let's come to the the core components of the culture. Every culture in the world is made up of these three words: the beliefs, the values, and the norms. Just make a concept about them. Then we will read in little bit detail. First, the similar belief people, they come together, they start spending their lives in an area, they share their own beliefs. If the beliefs are not similar, then a culture is next to impossible to form, right? As the what's the reason behind the partition of this Indo Pak? It's a belief. Is it, or isn't it? Obviously there are the Muslim beliefs, there are the Hindu beliefs. So the Pakistan and the India, they become independent because of this belief system. So first the people of the similar beliefs, they start gathering in the area. Then these beliefs, when these beliefs become translated in the form of actions, then we label it as the values. And when those actions of the area of the people, when those actions of the group of the similar people, uh, uh, the judgment begins on those actions, then we label it as the norms. Got my point? So what comes under the loop first? The beliefs. The people of the similar ideology, the people of the core ideology, they become gathered, they start spending their life in an area. When those beliefs emerges in the form of actions, as it's natural that every belief would be translated in the form of action, then we label it as action label known as the values. And when those values, when the people start judging each other, when the people start putting, the punishment and the reward system based upon these values, then it is known as the norms. Is it clear or not? So first are the beliefs, then are the values, and then comes the norms. Okay. So what are the beliefs? Beliefs are the opinions with the shared meaning in the culture, which everyone believe on it. With every person of the culture, there is no doubt in the beliefs. Always remember it. They can be doubt in the, value. They can be doubt in the norm, but there is no doubt in the belief. As in the Muslim society, you cannot deny the importance of God, right? It may be a small child, it may be a elder one, it may be a younger one. You cannot deny the importance of God. Similarly, in the healthcare setting, you cannot deny the importance of germs. Is it or isn't it? So beliefs are something which is have the shared meaning, which have the common meaning, which everyone, every person of the culture knew about it, practice about it, etc. Values are the desirable way of practicing the beliefs. Values are basically the actions, are the translated beliefs which the people show in the form of actions, right? Values are something which should be held in the high regard, which should be practiced by the people of the society. Like in the Muslim culture, if you will wear a dupatta, if you have a beard, then you will be appreciated. As value is a direct translation of the belief. So if you're Muslim by name, if you're Muslim by religion, then the people of the Muslim society, they will expect that you should behave in a Muslim manner, the manners according to the teachings of the Islam. So in the similar way, in a medical community, if you're a doctor, then the people of the your profession, then the patient will expect that the doctor should be ethical, doctor should do the ethical practice, etc. Got it? What is the difference between the value and the belief? Belief is something which is buried deep in the people of the culture, which are buried deep in the people of the society. When that beliefs, they become translating in the form of actions, then we will label it as the values. And when those values, they become the judgmental thing, where this value is right, you did this thing in the right way, you did this thing in the wrong way, then we will label it as a norm. Like before this COVID-19 thing, shaking hand is a normal norm of our society. It is the one who didn't shake hand, or the one who didn't respond to the salam of the person, he is considered as a rude, he is considered as a arrogant. But nowadays, if someone is shaking hand, then he will consider it as a illiterate. Got my point or not? So now this norm has become changed. Why this norm changed? Because the belief regarding the shaking hand has now been changed. Got it? So first are the beliefs, that is something which is in the mind of the people. Similar belief people, they make a group, then that group is labeled as the culture. And when those beliefs, they become translated in the form of actions, they will label it as the values. And when we start judging the people based upon that value, then we label it as a norm. Got it? Okay. Now please quickly write if it's confusion or something is not clear, because we cannot continue towards the next slides if this thing is this portion is not clear. Quickly. Okay. What about the other students? Okay, good enough. So far, what we have said, first is the belief. When that belief emerges in the form of practice, emerges in the form of actions, value. And when based upon that action someone is being judged, known as the norm. So based upon the, now listen please carefully, the next few slides very carefully. Values, okay, value is something which is the reflection of belief. Like it's a belief of the people of the Islamic culture that God is one. So when they will worship the God, then we will know it as a value that doing the 5 times pray is the value of the Muslim society. Got it? Why this value emerges that we should pray for the 5 times? Because of our Islamic beliefs. If someone is putting the beard on his face in an Islamic culture, then this value of putting the beard is comes directly from a belief in the mind of the Islamic people or Muslim people. So value is something which is the reflection, which is a practical reflection of the belief. Hopefully it's clear. So now, as we said that when the society, when the culture start judging a person based upon the value, particular value, then we will label that judgment as a norm. Got it? So based upon the severity of the judgment, based upon the severity of intensity of this right or wrong action, we further divided the norm into the three components. Let's see what are they. Folkways, mores, and the laws. This classification is from where this classification came. This classification came based upon the judgment of the norms, based upon the punishment of the norm. Like maybe it's okay to not shake hand in a Muslim society, but it's not okay, to lie. It's not okay to steal something. Got it? So based upon the severity of the punishment, severity of the judgment, we divided the norms into three parts known as the folkways, mores, and the laws. Let's see what are they. Folkway are something which you should follow. If you didn't follow it, then there is no practical punishment regarding this norm. Got it? Like it's expected that you should respect the elder people, but if you're not respecting the elder people, there is obviously no practical punishment regarding it. Got it? So the least intense form of the right or wrong, least intense form of the judgment, least intense form of the norm is known as the folkways, having the least punishment. Got it? So customary pattern of everyday life that specify what is socially correct or what is socially wrong is known as the folkways. That it is expected from a doctor that he should receive his patients with a smile. He should welcome his patients with the with the good attitude. But if someone is rude, someone is arrogant, then people will say that Dr. Saab is very arrogant, but they will not obviously punish the doctor. Got it? So this is an example of the folk way, least punishing, but most expecting. Now, next thing is the more. More. If the judgment become intense, if uh, the norm become so intense that in a society the people maybe show the strong disapproval, may show the strong punishment, then that norm is known as the more. Right? So what's the difference between a more and a folkways? Folkways is something on which there is no punishment, but it is desirable for people living in a society. He should do it, right? But on the more, there may be disapproval or the approval from the society. For example, if doctor is doing the illegal organ transplant, then it is something which is highly highly undesirable. If doctor is practicing some sort of sexual boundaries violation, some sort of pharmaceutical boundaries violation, then it would be considered as a more from the medical society. But always remember, the only difference between the more and our next norm, the laws, is that more is not formally written, formally compiled, whereas the laws are the formally written and the formally compiled. What is the meaning of this? That the laws are obviously governing by some sort of organization, some sort of government, some sort of law enforcement agencies, whereas the modes are something which are usually governed by the people of the area, people of the society, people who are living in the culture. Got it? Let me revise it. There are three core components of a culture. One is known as the belief, one is known as the values, and the third thing is the norm. Belief is something which is the core ideology of the people of that particular culture. When that ideology become translated in the form of actions, this is known as the value. And when the society, when the culture start judging the people based upon their actions, then we label it this value as the norms. Based upon this judgment, norms are further divided into the three things. If the judgment is just superficial, like you're doing something, you will be appreciated or maybe not appreciated, and you're not doing it, then it's okay. People will have the negative ideology regarding you, negative thoughts regarding you, but you're not punishable. Then this norm is known as the folk ways. If you're practicing something which the people will not the people will straight away refuse it, then it is known as the more. For example, in some Pakhtunkhwa area, if the male is checking a female patient, if doing the physical examination of a female patient, then maybe that male physician or the male doctor may got killed. Is it? So this is an example of the more. When those mores are regulated by some law enforcement agencies, when those mores become formally compiled, written somewhere known as the constitution, then those mores become the laws. Hopefully it's clear. Now quickly tell me one thing, is it clear or not? Quickly, other people also, so that we can jump to the next thing. Okay, good enough. Now, as we have seen that culture is something which is based upon the belief of the people, right? So as the people are coming from the different backgrounds, people are coming in the future when you will be acting as a doctor or as a treating dentist, people will be coming from the some poor background, from the some rich background, from the some educated background, uneducated background, urban area, rural area, etc, and etc. So obviously everyone have a different set of beliefs, set of norms, set of values, isn't it? Now there is no need to check the norms, values, and beliefs of every patient. Obviously, there is no need. As the 90% people, 99% people who will visit you in the future, they will obviously reflect some common culture, because we said that the people of the different beliefs or the diverse belief, we use the more specific word. Please put your focus on it. People of the diverse beliefs, they cannot live together in the similar culture, as culture is another name of the similar beliefs. So we have to perform this culturally sensitive clinical assessment only to those people who have the diverse values. I will give you a practical example. Let's say you're practicing in the Punjab, and someone, let's say, suddenly pop up from the Sarhad area or the some tribal area. He have the entirely different culture. He have the entirely different value, norm, beliefs. Maybe something which is okay while practicing in the Lahore, it may be not okay, it may be not fine while with practicing with the people who came from this tribal area, right? So for those people who have the 180 degree different culture, who have the entirely right angle different culture, different values, we have to do a thing known as a culturally sensitive assessment. There is nothing we do in this assessment. We are just finding the gap between our own values and between the values of our patient. That's it. We will teach you while doing the practicals, right? So it is very important to clear the concept of the heritage consistency. Heritage consistency means how the person is coherent, how the person is stuck to his own values, to his own beliefs, to his own norms. If the person is very consistent with his own value, belief, norms, then we will label it him as a consistent. There is a heritage consistency. Let's say a person is not adhere with the beliefs core and the values, then we label it as okay, fine, this person is now adopted the new culture. For example, someone among us visits some foreign country. He's used to live in that country. He used to become adapted with the culture of that particular country. Then this means that that particular person will have a less heritage consistency. Got my point or not? Means that this person now become adapted with the new culture. For example, someone from the Sarat, from the KPK, he become migrated in the Punjab 10 years back. Now he is well mergeable with the Punjab culture. Then there is no need to do this assessment. So if the MCQ came, a person have the very high heritage consistency. Now what's the need of cultural sensitive clinical assessment? There is no need. If the person don't have the heritage consistency, then yes, there is a need to find the gap. Got my point or not? Okay, there is another thing. Okay, so what we have said so far, if the person sticks to his own values very adherently, then we label him as the heritage consistency. If the person did not adhere to his own values, we will label him as the that he has no heritage consistency. So we will perform this assessment via the clinically this uh, uh, you know oh, just a minute, this culturally sensitive assessment. So they develop a protocol whose mnemonic is the learn. What is the theory behind this protocol? The theory is that as there is no cultural, please listen it. It's just the end of the slides. One or two slides may be remaining. So as they develop that, someone who have no heritage consistency, we should perform the assessment, clinical, which we learned in the previous slide, right? So what is the purpose of the assessment? To find the gap between his culture and between the culture in which he is living, right? And then we have to negotiate that gap. What we mean by negotiation? If the gap indicates that he has certain values which is hampering his disease and the health practices, then there is need to little bit modify those values, right? Someone from the KPK, he's have the very scientific beliefs, prefer visiting doctors, have the very high treatment adherence. There is no need to negotiate with his values. Got my point? Someone from the Punjab who have the values who are hampering his treatment process, there is obviously need to negotiate with the values of the person. For example, in future a patient comes to you, he said that he may develop the some fibrosis. His mouth is not opening properly and he's chewing the tobacco, and he learned from his grandfather that while chewing the tobacco you can live 100 years life, for example. So now here is a need to negotiate with this value which he adapted from his own family. How we will negotiate? We have developed a protocol known as the represented by the learn. It's known as the Fox and the Berlin approach. What they said? They said that first listen to your patients, then explain each and every component, then acknowledge the gap. Okay, this gap is lying there. Then recommend something based upon the scientific knowledge, and in the end negotiate. How you will negotiate? As you have learned in the counseling skills in the section A, as you have learned while resolving the conflict in the section A, etc. You will negotiate while telling the patient that okay, uh, go and perform your this practice, but along with this practice do this thing also took this medicine in this way. Okay, just quickly go through this slide. I'm not reading it as it is a reflection of the whole uh, the previous lecture. Quickly read it. Okay, just a minute. Let's stop it here and just have a quick review regarding what we have uh, learned today. So culture is something which shapes our beliefs. Those beliefs directly shape our practices. Culture is based upon three things: value, belief, and the norms. Belief is something which have the shared meaning. When those beliefs they come into the practice, we label it as a value. And when the judgment comes on this value, known as a norm, if the judgment is very light, folk ways, if the judgment is very severe, punishable, modes, and if the modes are written somewhere, regulated by some authority known as the laws, right? If the person is very consistent with his own with value belief norms known as the heritage consistency. If the person is not consistent, then it would be known as the he doesn't have a heritage consistency. Got it? So those who doesn't have a heritage consistency, we need to find the gap and then negotiate with it, which we have covered with the mnemonic known as learn. First you have to listen, then you have to acknowledge, then you have to negotiate. So that was a summary of the whole lecture. So if there are any questions, then please ask. No questions. Strange. Okay, then take care. Allah Hafiz.